Is it AI or teleradiology? So we have three very eminent speakers who are all going to give us their views over a 5-minute period. Then we're going to draw it together and see where the future lies. We will start with that's Henrik Agrell, who qualified from the Karolinska Institute, set up a very eminent teleradiology company in 2002, and is one of the co-founders of this. Followed by this, we have Prashant, Warier, who is the co-founder of Qure.ai, came through IIT in India, then has a strong machine learning background, and tying this all together, we have Dr. Visser, who is an assistant professor. He's a radiologist, so he's a cool guy already in my eyes, and at CIML at the Erasmus Medical University, who has a background in value-based imaging. I suppose the first thing we should probably consider is what do we mean by teleradiology. We're not going to go into what does AI mean. And broadly, there are two interpretations of this. We have what I do at my hospital, which is there is too much work, not enough radiologists, and we outsource work to teleradiology companies. Then we can use a principle in the purest sense of the word, which is how do we provide radiology input in areas which don't have enough physicians, clinicians, radiologists, and to bring the far near. And I suspect that these are some of the themes we're going to touch on. So if I start with you, Henrik.
Thank you very much. To start with, I think it's quite interesting to discuss also teleradiology. Teleradiology has been a term I used for quite a few years. I think especially now after the pandemic, where most of our radiologist colleagues at least dedicated some of their time from reporting from home, I think the term teleradiology might start to become a little bit irrelevant. It's more, when does it make sense to do on-site radiology? Because today I think the benefits of doing teleradiology, meaning radiology in a network where you can make sure that you subspecialize, even if it's public, clear run network, or if it's private providers, is probably the standard today, or should be the standard today, I think. So I think it's more relevant to discuss on-site radiology as an exception. But that's, a little bit of a standpoint. So I think this title is extremely interesting, AI or teleradiology. I noticed that it was changed a few days ago from and teleradiology, so I really like that interesting starting point for discussions today. Team C, we have been providing teleradiology services now for the last 20 years, and we are since 4 years back part of the Unilabs group, which is one of the leading diagnostic players in Europe. And we started to adopt AI solutions quite early on. So already a couple of years ago, we started to implement the first AI solutions. And today we have in the group around 10 AI solutions up and running, if we included 2 ones that we now have also for portfolio. But we have 7 or 8 active AI solutions that we use on a daily basis within the area of radiology. And this is extremely interesting because we can see that the benefit we get from these solutions is quite tremendous, mainly so far on the quality side. It takes time to both test, implement, but also to learn how to use AI solutions. And that's coming back to one of the talks we had this morning with Jacob as well, on value-based radiology and the value with subspecialization. We think that it's quite important also to subspecialize radiology when it comes to AI, because it is complex to learn how to use AI solution in a correct way. And it's much helpful if you are a relevant subspecialist within your specific area to also learn the specific AI solutions that are tailor-made for that specific area. We think it will be quite difficult to think that a generalist radiologist will sit there with 20, 30 different solutions to try to navigate from all this output you get, try to understand what's behind the data. But if you have a smaller number of AI solutions for your specific area, take neuro for example, then it's more likely that you will be able to use these solutions in the most relevant way, because it takes time to really learn how to use these solutions to both bring the quality addition that you want, but also to make you more efficient. initially when you implement AI solutions, you typically get less efficient because you need to learn how to use the solutions. It takes time to interpret the output. The solutions might not from the beginning be very well integrated into the workflows, so you can expect a decrease rather than an increase in efficiency initially, right? So that's an interesting observation that we've done so far.
Thank you. So if we can turn to you, Prashant.
Thank you, Rizwan, and thanks for the introduction, Henrik. I'm Prashant Warier. I'm the co-founder and CEO of Qure.ai. At Qure, we are deployed across about 60 countries now, 60 plus countries now, across about 700 plus sites. So fairly widely used, and we work with teleradiology providers. So we are today announcing a partnership with TMC, right? And again, that's sort of more sites that we offer services to. And I think, AI, we have a wide range of AI products, but like what Henrik said, it is important to be able to integrate it into the workflow, and that requires time. Whenever we have done that across all these sites that we deployed at, it takes time to ensure that AI is invisible. It should be invisible, right? When we use a Gmail or any kind of AI that we use as part of Google services or Netflix recommendations, it's invisible. AI never sort of comes to the forefront. So that is how AI in healthcare also should be, AI in medicine, radiology should be. And that's where you have to make it invisible. You have to integrate with all the tools out there, whether it's a PACS or a RIS. You have to make sure that everything sort of works together seamlessly. And that's something that we have strived to do. Our solutions are, again, for interpreting chest x-rays. One of the things we are talking about, we are deploying at TeleMedicine Clinic is basically calling out whether an X-ray is remarkable or unremarkable, because that's the main decision point. That you have got a large number of X-rays. A lot of sites that we go to, out of 100 X-rays, maybe about 70, 80 are normal. So can we now say that these are unremarkable X-rays, and can we help turn around those X-rays faster? Can we reduce the turnaround time for reporting those X-rays? So that is the solution that we are deploying at TeleMedicine Clinic, and the idea is that you can say, out of the X-rays that are taken, you can say these are normal, these are unremarkable, these are abnormal, and then within those abnormals you can basically mark out where the abnormality is, identify about 60 different abnormalities, and create a textual report, right? So that's the X-ray solution that we have. We have a CT solution which can detect various kinds of critical findings on head CTs, and we also launched about a year ago a chest CT solution which can detect nodules from chest CTs and basically around lung cancer detection. So I'll pause there. I think we have a broad variety of solutions. We want to get into more details there and hand it over to Dr. Visser.
Yes, thank you, and thank you for the invitation in this panel. I'm a radiologist and also an assistant professor in value-based imaging, and I think that we all realize that at the end of the day, it's all about value, right? We want to be of value for our family, for the hospital we work for, and also for the patient that we take care of. So at the end of the day, talking about AI and talking about implementation of AI, the question is, does it add value, right? And adding value, that may depend on the local situation. So, for example, if you have a triage tool for intracranial hemorrhage, without having a backlog on neuro CT scans, it doesn't really make sense to use that triage tool. And this is a very obvious example, but it's always very important to realize what's the added value of a particular AI solution. AI is not a goal in itself. It's just a means to come to adding value for patient care and improving patient outcomes. And then, of course, we also have to realize that algorithms may differ, may show different performances in different hospitals, because there is the case mix. It's very basic epidemiology that if you train a model on specific cases, that you cannot, by definition, apply that particular model to another case mix. You should investigate that. So that's why it's very important to do research among different hospitals. and to verify if the models that were developed are still doing what we aimed for. And then it's important to realize that talking about value, it's not only value for radiology. There will be value applying to radiology examinations that will be downstream benefit the patients. And in order to get to the business case for AI, we should evaluate along that care pathways and not only focusing on the radiology departments. And that brings me to the last point. I get a lot of questions nowadays about the business case, right? At the end of the day, companies have to survive. They need money. But we have to spend the money a responsible way. We cannot just pay for something and we do not know what's the added value. So we need thorough evaluations and also making sure that the benefits outweigh the costs when implementing AI algorithms into clinical practice.
So thank you for those very three interesting perspectives. I guess going back to the exam question of AI or teleradiology, perhaps it isn't even AI and teleradiology. I guess the question is AI in teleradiology and how we can best leverage that to meet the demands of too much work, not enough people, and although the world seems to be growing smaller by the day, we do still need medical input at the base camp of Everest and some of the far-flung places of the world. And anything we can do to make the humans work more efficient and basically leverage virtual radiologists in a safe and consistent manner would perhaps be a goal. And I guess in that regard, the question is how AI and teleradiology companies can work closer together to facilitate that.
Yeah, I mean, we are today providing around 150 plus hospitals with reporting services in Scandinavia and in the UK. And going to the UK specifically, right, there's a massive shortage of radiologists, full stop. What we have to do currently is to basically tell most of our clients, don't send us more cases, we don't have capacity. So that's the reality today, right? So we need AI solutions fast to help us to make radiologists more efficient and preferably to take away some of the activities radiologists do today, because that's the reality. We need to free up more radiologist capacity. The same thing is for Scandinavia and a number of other European countries, with some exceptions. So that's the reality. And I think listening also to the previous panel debate here today, when we hear that some of the representatives from the different AI companies say that in 5-10 years, perhaps these solutions can replace some of the work done today by radiologists. That is not quick enough. I think that some of the AI companies today need to become a little bit more aggressive to try to push through some of these solutions faster. They need to consolidate a bit, because we cannot have 20 different, 30 different vendors to cover the areas that we need to cover. So we need solutions that actually fast can help us to become more efficient. And if they sit with our clients or sit with us, they need to sit somewhere, because the capacity shortage today is growing into a catastrophic situation right now. That means that cases will not be reported in time. That means that cases will be reported by less qualified radiologists. And that's the reality today, right? So I think these solutions now quite quickly need to show significant efficiency gains, because that is needed, and that's fast.
I think you made a very valid point, Rizwan, that value of AI, and in fact for teleradiology also, is in providing access. And when you, especially, I mean, for us, I mean, when we look at companies that are there in this space, I think we are probably one of the only companies who's catering to the emerging markets. And when you look at rural parts of India or Africa or Southeast Asia, you don't have access to radiology. I mean, you spoke about Everest Base Camp, I mean, where we went and we deployed AI there at Everest Base Camp, and there is obviously no doctor there, let alone a radiologist, right? There is not even a physician who's available there, but imaging can be made available. Imaging is in fact available. So especially X-ray imaging. So if you can provide support to them through a sort of remote radiologist through AI, that becomes very useful. And when it comes to teleradiology, I think the question is, of course, the exam question is AI or teleradiology, but reality is, I think it's together, right? AI plus teleradiology, and that is the value proposition, because you don't have to, I think as we are seeing, radiology is moving away from the hospitals. There are more people reporting from different locations. I was at a conference in UK recently where they were talking about reporting from the beach in Australia, and I think it was a TMC ad, it was a TMC brochure. So I think that's where, people can report from anywhere, and ideally you want the readers to be comfortable, and if you can do that, great, right? And that's where AI can also come in, because AI can provide that interim report, can provide triaging support, can identify where the abnormality is, can quantify things, can sort of measure progression. So AI, think about it this way, that, if you are looking at it from if you look at imaging itself, right? All these imaging techniques are about, except for X-ray, everything else is about 30, 40 years old. It's not like MRI, CTs are not that old. And when you look at future of AI, future of radiology, it should be where, there is already a lot of pre-processing happening to be able to produce that DICOM, and for you to be able to see that DICOM in a PAC system. Now, if you were to see that with all the findings, with all the abnormalities already marked out, or at least some of the abnormalities marked out, some kind of a interim report there, that becomes much more valuable and can save time for a radiologist, and which is where, I think with the lack of, in UK for example, with the lack of radiologists, that becomes extremely valuable. And I think that's where AI and teleradiology will play a significant role in helping improve the efficiency, and helping improve the quality of radiology. And,
Yeah, I definitely agree, and I think it will be not or, but indeed it will be and AI and radiology, because the throughput of teleradiology is rather high, right? So there is a lot to do with workflow. So if you can use AI in directing radiology exams to a specific radiologist, or pop up the clinically most relevant cases, PE, so pulmonary embolism, or intracranial hemorrhage, or pneumothorax, then you are basically increasing efficiency, because reporting on the same case will increase efficiency, and also improving quality, because you lower the turnaround time for those critical cases. So the combination, that will definitely be the way to provide value.
Yeah, I can mention, just one of the tools we're using today to detect incidental PEs, where we typically have a reporting, turnaround time of 3-4 days, because it's elective radiology. If the AI tools detect suspected PE, we can report a case within hours instead of within days, right? So that's clearly the value we have. But we also see now another request from our client hospitals out there, especially small hospitals that might have a limited number of radiologists locally. They also would like to have the benefit of getting access to AI, but they don't really have the local capacity or knowledge to decide which solutions they should implement, how to evaluate them. So we start to see now an increase in requests from our client hospitals to get access to curated AI solutions. So we are being quite a large reporting house. We have a larger capacity, of course, but also a larger number of subspecialists to evaluate and to learn how to use AI solutions, to understand how to interpret the results. So we are now looking into services where we still get the cases, we process them with AI solutions that we have contracted, and then we send back the results, perhaps training our client hospitals how to understand these results. So by doing that, we can both support them with some reporting, but we can also facilitate more local AI-powered reporting with curated support, because that is one of the major challenges for small to mid-sized hospitals to implement AI solutions. It's not necessarily only the technology things, but it's the clinical evaluations and how to use these tools, and that they need support with that. And that's a role that teleradiology can play as well.
So thank you all for your time, for that fascinating discussion. And I think we have come to the conclusion that the future is AI in teleradiology, and here we've had a demonstration of Qure.ai deployed with TMC.